for dental implants, this whole teeth in a day concept, you walk in with no teeth, you walk out with teeth.
Yeah.
Some people might say in certain cases it could be exaggerated, right? And some people aren't the best candidates for teeth in a day. Elaborate on that.
Well, I'm glad you brought this up because, you know, we see this about 3 cases a day. And, you know, we're not going to leave you without teeth. You come in, you don't have teeth, you already have dentures. We're not going to leave you without teeth, but there's just so many cases to where, you know, there's a reason you lost your teeth to start with. And you don't typically lose something that, you know, God's made easily. So I briefly just want to say this.
All right.
You know, often we put the implants in, but we really want to let them rest. I call it, we really want to let them integrate and bond to the bone. Okay. I mean, if we've waited this long, or you've waited that long as a patient, to get something that's fixed, or we call it the 3rd set of teeth, why do we want to hurry it up 2 or 3 or 4 months? Let's just be patient.
But they're never left without teeth, so they still have teeth.
Right.
But you like to put in the implants, let them sit maybe.
Yeah.
Marinate.
Yeah.
Well,
yeah, that's free, of course. But no, I just think that we need to kind of evaluate each person individually.
Okay, good.
And so, again, you're going to leave with teeth, but if you want it to last a long time,
because you could do teeth in a day on everybody if you wanted to, right?
But
you think it's risky? I don't want to put words in your mouth.
I think it's risky.
Okay.
You can absolutely. I'll make a statement immediately because I've been placing implants since '94. I've trained all over the country and
other dentists.
Trained.
Okay.
And I've also taken. I have to train too.
Yeah.
I mean, and so I'm out of the country training. I'm learning techniques that are not taught here in America. So, I mean, I want to be on the cutting edge academically and professionally and with our equipment. But I don't want to be foolish. I mean,
all right.
Yeah. So we just...
So the patient needs to understand that you may want to slow it down just a little bit, but they're never without teeth.
They're never without the teeth. And so I know there are a lot of ads, there are a lot of things going on now, and just kind of look at both sides. That's my advice. And look at what makes sense, you know, and if they can't explain it well, then go somewhere else, get another opinion. So,
but in Tennessee, you're kind of the implant king, though.
It really has worked out.
I mean, every day, because I've had you on the show.
Yeah.
And people, I mean, every day they feel like they know you, I heard. Your wife said they feel like they know you.
And that felt a little corny in the beginning, but now I know why that is. First of all, the answer is yes.
Okay.
Second, I feel like I know why this is, and my team, because we sit down and we talk about this, is it was really natural. See, when you believe and love and you know what you're doing is the right thing, it comes across.
Good.
So...
now, I have to ask you, did they ever come in, do they ask about me? I'm joking around.
You're not going to believe this.
Just joking.
No. I showed a case in one of our interviews.
Yeah.
And it was the young kid, or he's younger than me, and he had lost a couple of teeth, been in an accident, absolutely love him. And he said to me, I think it was Monday of this week, it was either Monday or Tuesday. No kidding, I'm not going to lie to you because you're the man. And he said, you know, that Alvarez guy, he smiles all the time, you know. And the fact that he remembered your name, that kind of flipped me out a little bit.
Yeah.
So, no, it's a real deal. Who I am right here with you is, according to many, and I believe it, and I appreciate that, is who I am when I'm with our guests, our patients, our clients.
But nobody likes going to the dentist. But your wife says they love going to you.
They do. I mean, we'll get a few people that don't, but they, you know.
Do they ever say, hey, no offense, doctor?
Oh, every time. I mean, I hear it all the time.
Do you have a good comeback after all this time?
Yeah. The one we used for the first 15 years, I've kind of mellowed out on because I ticked off a few. And they'll say, no offense, which is always a disclaimer. I mean, that's kind of like saying, you know, I've got to be honest here. Well, what were your other options? You're going to lie? They'll say, no offense, doc, but I just don't like coming to the dentist. And I'll say, oh, you know, no offense taken. I don't like patients. And so I had to tone that one down a little bit. Right? Yeah, it was funny to me.
So what do you do now?
You know, I empathize. I sympathize with them. Because remember, I was one of those people. Now I love coming.
Good,
so,
good.
You know, treat them right. Don't hurt them. Help them with things that they don't even know sometimes. And just, you know, be fair to them.
Okay, good.
Help them out.